Hi.
How are you?
Good, how are you?
Alright, so I know that you came in because you weren't feeling well, you kind of have a cold, hasn't really gone away.
Right.
Yeah, it sounds like you're
Sorry.
not feeling well.
No.
So we're just going to go ahead and do our full head to toe assessment, but we're just going to start with some vitals, height and weight and all that stuff, okay?
Okay, sounds good.
Have you had fevers?
I haven't checked it, to be honest.
We're just going to check your temperature under your tongue. .98.3, so no fever, that's good. Alright, I'm going to go ahead and check your blood pressure in both arms. What does your blood pressure normally run?
Normally it's like 110/70. Even when I was pregnant with my daughter, I never really increased.
Okay.
If anything, I actually went a little bit lower because I had a hard time keeping food down. Sorry for the coughing.
Okay. Just going to pop that up one more time. Okay. 108/58 on that arm. We'll check this one.
There goes.
Sorry about that.
That's okay.
.104/60. So not much of a difference there. Blood pressure is within normal limits. I'm going to go ahead and check your pulse. Alright, your pulse is 70, and I actually checked your breathing too. It was 17.
Oh, okay.
So, alright. Now we're going to go ahead and move on and just do like a general, I'm going to look over your skin, your hair, we're going to look your back, like your feet and all that, and then we'll move on to like your head, face, neck, and then try to, cover all the systems, okay?
Okay.
Yeah, and then we'll have to get your height and weight as well. Your hair looks good. Any dryness that you've noticed?
Mm-mm.
Any lesions, scars on your head that I need to know about?
Nope.
Okay, I'm gonna check your arms here. Any issues? Anything on your chest? Any scars?
I have a scar under my breast here from a mole gator bug.
No past surgeries, right?
No.
Okay, your legs look good. Good. We'll check your back here.
My hair everywhere, sorry.
It's okay. Just a few tattoos.
Yes.
Okay.
I have 3.
Okay. Good. Then we'll have you hop on the scale really quick. Alright, go ahead and hop on there. Good, and then we'll have you just turn around. And you are 5'4". Has that weight been about the same for you? I know changes. Okay.
I wish changes.
Alright, so now we're going to move on to your head, face, and neck.
Okay.
So I'm just going to take a look here.
Do you need me to take my glasses off?
No, that's okay. So your face looks symmetrical to me. Can you give me a smile? Alright, good. No drooping or anything that I notice. Your neck looks aligned. Just gonna check your trachea here. Trachea is midline, no deviation that I can see. Does this feel tender? I'm just gonna look at your glasses. Just feeling for your lymph nodes just to see if any of them are tender, especially since you're kind of not feeling well.
It was a little tender when you were across here.
Okay. It was a little bit more palpable than normal, but, you know, since you're sick, just checking your axillary lymph nodes. And then you do have, can you just lean back just a little bit? You do have lymph nodes here. Tender there at all?
Nope.
Alright, and then I'm just going to take a listen to your carotid and temporal arteries. Probably just go ahead and feel them
I'm
first.
sorry for that.
Oh, that's okay. Those feel equal. Just going to check these one at a time. Feel strong. No thrills that I can feel.
Okay.
So we're just checking to make sure that you have normal blood flow going through there.
Okay.
No worry or turbulence that I can hear. Awesome. Great. And then we'll move on to your chest and lungs. I'm just going to move your glasses here.
Thank you.
Is it okay if I have you sit to the side of the bed again? I'm actually going to start in the back.
Okay.
Can you just take a few deep breaths for me? Good. It's very symmetrical. It's good chest expansion. Take another deep breath. Alright. Good thoracic expansion. Alright. And then I'm going to just,
Sorry.
No, you're
I could tell
fine.
it was in your way.
Just feeling no crepitus that I can feel. Alright, and then I'm going to just press here. That all sounds resonant. A little bit more dull over the kidneys. And then while I'm back here, I'll just take a quick listen. Just going to move your shirt out of the way. Can you take a deep breath? I'm just going to watch you take a few deep breaths from the front.
Okay.
Good. Still looks equal, symmetrical. I'm not seeing any signs of respiratory distress. You're not using any of your accessory muscles. Just feel for crepitus here. No crepitus noted. Just take a quick listen to you. Sounds very clear. I haven't heard any adventitious breath sounds such as wheezes. those all vestibular breath sounds, nothing out of the blue.
Okay.
Even though you're kind of not feeling well. How about your sputum? Have you coughed anything gunky up at all?
I'm not coughing it up. It's just all like nasal drainage mostly.
Okay. All right. And then I'm actually going to have you just go ahead and lay back. And then we'll just do a cardiac assessment now.
Okay.
So, no JVE noted. None that I can see. Okay. And then I'm just going to feel. Good, strong heartbeat. Okay. And I'm just going to pull your gown down a little bit. Just breathe normal.
I'm sorry.
S1, S2 heard. Okay, your S1 and S2 are normal. I didn't hear any heart sounds that shouldn't be there, such as murmurs, clicks, gallops, anything like that. That all sounds normal. And then before we kind of finish the rest of the body, I'm going to just have you sit up.
Okay.
I need to do a couple more things to just check the rest of your lungs, and then I'm going to go back and check your ears, nose, and throat. Okay? All right. Can you just say 50-50 for me?
50-50. 50-50.
Okay.
50-50.
All right. The tactile freminous sounds normal. Feels normal. And then I'm just going to have you say 99 and Mickey Mouse. Just alternate.
99. Mickey Mouse. 99. Mickey Mouse. 99. Mickey Mouse. 99. Mickey Mouse.
Okay. And now I'm going to have you just whisper 1, 2, 3 over and over.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so that actually those all sound muffled, which is the way it should sound. So
Okay.
that's good. And then I'm just gonna start with your eyes here. All right, so this is a bright light. Just want you to look straight ahead. All right. Pupils are equal, reactive to light. They accommodate. Just gonna check your pupils here. Red light reflex noted. I can see your blood vessels. Corneal light reflex. I don't see like any conwall, anything like that. Looks good. Red light reflex. That looks the same as the other eye.
Okay.
And while we're here, we're just going to do blink reflex. Good. Okay. Any ears or eye, nose problems that you've had in the past?
No, not in the past, just frequent sinus infections.
Okay. Alright, I'm just going to look in your ear. Tender back here at all?
No.
Is it good? Your tympanic membrane is clear. It's gray. It's pearly. Looks intact there. Looks clean. Very good. Alright, this one looks exactly the same. Pearly, white. No issues, no redness or anything like that. So that's good. Doesn't look like you have an ear infection or anything. Alright, then I'm I'm just gonna look up your nose here. You definitely got some drainage, but it's pretty normal with your symptoms. It's a little inflamed. You've been blowing your nose a lot, I bet.
Oh yeah.
No deviated septum. Those look okay. Your ear, nose, and eyes looked all normal. So now I just want to check your mouth and then try to get a peek at your throat. Okay. Just gonna grab a tongue depressor here. Can you just stick out your tongue and say ah? Just use the light here. You still got your tonsils. Your uvula moves up and down. It's not too big. Show me your teeth. All right, good dentition. Your lips and your mouth are pink and moist. I didn't see any like thrush or anything on your throat, so that all looks good. All right. So now that we're done with that, I'm actually gonna have you lay back.
Okay.
Do you want your glasses back?
Yeah, that'd be great. Thank you.
There you go. All right. I'm gonna lift up your gown.
Okay.
And then just lift up your shirt here just so I can take a look. I mean, looks symmetrical. I don't see any scars or lesions, or I don't see any pulsating. Looks fine. Any pain to light palpation? Okay. No tenderness with light palpation. I'm just gonna take a listen. Sorry, my stethoscope might be a little cold here. Okay. Bowel sounds present in all quadrants. So it's tympanic over your stomach, dull over your liver, which is how it should be. Any pain when I do that? No. Feel the edge of your liver there, that's good. No tenderness still?
Nope.
Okay. So, no guarding, no tenderness, no, I didn't feel any masses or anything like that, so that all looks good. Just pull your shirt down. I'm gonna go ahead and check all your pulses.
Okay.
Just gonna make sure that they're all even here. Just gonna check these again. Sorry, a lot of these kind of overlap. Very strong. Your radials were 2+. I'm gonna take off your socks here. 2+. Your feet are warm. Good capillary refill on your toes. Post tibs are 2+. Good color on your legs. No edema. Check your nails here too. Alright. Good capillary refill. Can you go ahead and put your thumbs together? There you go. So that's good. We're just looking for nail clubbing, which you don't have. It would just indicate some kind of respiratory issue, which you clearly don't have. While your feet are uncovered, I just want to take a look at the bottom of your feet. Those look good. Okay. And now we're going to go ahead and do a musculoskeletal assessment, so I'll put your socks back on.
Okay, here I can do it. Okay. Sorry.
It's okay.
Thank you.
And then we'll do a neuro exam as well, and finish off with that.
Okay.
So the neuro exam will be pretty in-depth.
Okay.
So can I have you just sit to the side again? While you're sitting up, I'm going to just check your kidneys really quick.
Okay.
Have you had UTIs in the past?
I only had one once, and it was when I was pregnant.
Okay, no kidney infections or anything like that?
Nope.
Okay. You just tell me if that's tender at all.
Nope.
No? Good. Okay. Alright. I'm just gonna have you, we're gonna do the mini mental exam. Sorry, I just gotta grab the test here. Alright. So what is the year?
It's 2018.
Season?
That's spring.
Date?
It's the 17th.
Day of the week?
Tuesday.
And the month?
April.
Alright. And then where are we right now?
Edward Hospital.
What state is that in?
Illinois.
County?
No, DePage.
Yeah.
Naperville. Sorry.
City?
Naperville.
And then what floor are we on?
The 6th floor of the Heart Hospital.
Okay, awesome. So I'm gonna name 3 things, and then I'll have you repeat them back to me, and then after the exam, I'll ask them again just to see how your memory recall is. Okay. So it's gonna be dog, light, blue. All right. And then I would like you to count backwards from 100 by sevens.
100. 93. 86. 79.
Okay.
72.
Okay, last one.
65. Yeah, 65. Okay,
good.
sorry, I had to recheck that. I was
It's
like,
okay.
that doesn't seem like the right answer.
All right. And then what is this that I'm wearing?
A watch.
And what do you do with it?
Tell time.
Okay, awesome. And then what is this?
A pen.
Okay, and what do you do with that?
Right with it.
Awesome. And then can you go ahead and tell me those 3 words that I told you?
Dog, light, blue.
Perfect. And then can you repeat the phrase no ifs, ands, or buts?
No ifs, ands, or buts.
Okay. And then I'm going to hand you a piece of paper, and I'd like you to fold it in half. And after that, I'd like you to fold it in half again. Good. And then I'm going to show you a picture, and then I'd like you to just copy it.
Okay.
All right, so here is the picture. Okay, good. And then can you make up and write the sentence that includes a noun and a verb? Okay, Heather went to the store. Perfect. All right. And so you passed that test. The score was out of 30. You definitely got a 30. No issues there. And then we'll just go ahead and do the cranial nerves now.
Okay.
So I'm going to have you close your eyes. We're going to test cranial nerve number 1, which tests your sense of smell. And I know you can't really breathe out of your nose, so if this might be a little bit diminished.
Oh, it smells like coffee.
Okay, very good. Yeah, I mean, you sound stuffed up.
Sorry.
No, that's okay. And then, so that's intact. Cranial nerve number 2, we're going to check your peripheral vision and then your visual acuity.
Okay.
So I see that you wear glasses. I'm going to just have you wear the glasses for the test.
Okay.
I'm going to take a step back, and this is the Snellen chart. So just read the smallest line that you can.
Okay.
Okay?
LTFPH.
Can you read it backwards?
HPFTL.
And then can you cover one eye and just read the first 3 letters?
LTF.
Okay. And then cover the other eye, and then can you read it backwards?
HPF.
Perfect. All right, and then just look straight at me and just tell me when you can start seeing my
I
fingers.
can see.
Perfect. So those are still intact as well. And then we're going to check 3, 4, and 5, which are your eye muscles.
Okay.
So I'm just going to have you follow my finger just with your eyes. Don't move your head. Good. Cross. And then good. Awesome. So those are intact as well. Can you open and close your eyes? Can you close them shut? Tight. Perfect. Open. Awesome. All right, and then we're going to check your facial sensation as well. Does that feel the same?
Yes.
Okay, I'm going to have you tell me what side of your cheek. Tell me what side of the cheek I'm touching. Sorry.
Left.
Does that feels the same? Exactly. Okay, perfect. All right, and then have you we're gonna check your TMJ muscle. So I'm just gonna put my fingers here. Can you open your jaw and close? Now bite down. Good. Those muscles feel strong. All right, and no clicking. That doesn't hurt at all when you. Have you ever had any clicking or anything like that? Okay, sounds good. All right, and then we're gonna check cranial nerve number 7. So can you raise your eyebrows, puff your cheeks, give me a smile and a frown. Perfect. All right, and next we're gonna check cranial nerve number 8, which is your hearing. So I'm gonna use the tuning fork, place it on top of your head. You'll just let me know if you feel and hear it equally on both sides. Okay.
Yes.
Okay. All right, and now I'm gonna just place it behind your ear, so you'll tell me if you feel it, and then I'll put it next to your ear, and you'll tell me if you can hear it on both sides. Okay. Equal on both sides?
Yes.
Okay, perfect. So cranial nerve number 8 is intact. And then we're going to check your gag reflex now. Are you ticklish? Okay. And then we'll check your swallowing after that too, okay? Stick your tongue out at me. Okay. Toss that. I have some water here. Just want to watch you take sips of it. Have you ever had issues swallowing, been on a modified diet or anything like that?
Nope.
Okay, good. All right, and then cranial nerve 11, we're going to check the muscles and the movement of your head and neck. So can you just look up and down, side to side? Can you try to bring your ear to your shoulder, other side? Any issues there?
Nope.
Good range of motion, no pain, so that's good. And then cranial nerve number 12, last one. So can you stick your tongue out at me? Wiggle it side to side. Okay, perfect. So no deviation there that I noted. And then, so now we're just going to move on to musculoskeletal.
Okay.
And then I'll have to check some sensation in all of your extremities.
Okay.
And then I think we've covered most of it. So while you're sitting, I'm just going to check your joints here. Okay, so that is about that's 180, perfect. And then I'll have you bent your elbow as far back as you can. And that is about 55. Okay, and then we'll check the other side just to make sure that it's equal on both sides. Symmetrical. So that's 180, and then bent. This is about 57, 58 or so, but it's pretty close that it's symmetrical. Alright, can you bring your arms like this? Pull, push. Alright, that's strong. And then a hand grasp. Can you pull me towards you? Push me away. Alright, those feel strong. 5 out of 5, equal. Then kick this leg out for me. Push down. And then up, perfect. And then other way. And then resist. Awesome. 5 out of 5 on those. I'll have you just push down like you're pushing on gas pedals and then bring these up towards your nose. Awesome. That also is very strong, equal on both sides. And then we'll have to check your sensation here. Alright, so this is a tool. This is just the sharp side. You can go ahead and feel that. And then this is the dull part.
Okay.
I'm going to have you close your eyes for the entire thing.
Okay.
We're going to do this kind of all over your body.
Okay.
And you'll just tell me, we'll start with the legs actually.
Okay.
You'll tell me what side I'm touching and then if it's sharp or dull.
Okay.
Okay?
Right. Sure. Right. Sure. Left. Dull.
Okay.
Right. Sure. Left. Sure. Left. Dull.
Okay. Then we're going to move on to your arms here.
Right, dull. Right, sharp. Left dull. Left sharp.
Okay. We won't do that on your face because it's a little pointy. But I do just want to check. Can you do some circles with your ankles? Good. And then I'll have you stand, and then I'll have you bend both of your knees.
Okay.
Yep. Good. And down, up, and down. Good. Then can you take a few steps forward and backwards for me? All right. Your gait is normal, no shuffling. You're steady on your feet. I'll have you just keep standing. Close your eyes. Can you bring your feet together? Good. All right. You've got good balance. I am just going to kind of nudge you just a little bit to see if you can keep yourself upright. Good. All right. And then can you open your eyes and then walk heel to toe? Okay. And back. It's okay. All right. Very good. Okay, and then we'll have you sit down. Great. So now that we've done your full neuro assessment, all your cranial nerves were intact. I didn't see any, abnormal neurologic signs. Musculoskeletal wise, all your joints and extremities are 5 out of 5. You have a good gait. No, you're not unsteady. Your spine is very aligned. I didn't notice any abnormalities such as like lordosis, kyphosis, or even scoliosis, anything like that. So that all looks good. So lastly, I just want to check your reflexes, and then we'll just check the vibration over, so bone conduction throughout your whole body.
Okay.
And then, we'll get you out of here. We'll have to probably send off some stuff just because you're clearly not feeling well. Probably put you on some antibiotics, but then we'll get you out of here, okay?
Okay.
Alright, so I'm going to have you just rest your arm here. Awesome.
That felt so weird.
Yeah. Alright. And then I'll have you just hold your hands together. Check your knees here.
Oh gosh. Oh, sorry.
It's a very strange feeling. Alright. Then I'll have you lay back, and then the last time I'm going to ask you to do it. Alright, so we're going to start distally and then work our way up.
Okay.
Have you close your eyes just so you can be in tune with the feeling. Let me know when you can feel it, what you feel,
Okay.
and if it feels different, because we're going to just go from like left to right and then so on. Okay?
Yeah, I feel it.
Same?
Yeah, it's like a tingling almost.
Okay.
I feel that.
Same?
Yep.
Okay.
Yep. Yep. Still that tingling, like vibrating sensation.
Okay. Alright. So Heather, we will just send you home with some antibiotics. Just rest and plenty of fluids. And then if you're not feeling better, just give us we'll just sorry.
It's okay.
I'll just have you come back and then we'll discuss about what we can do further, okay?
Okay.
Alright, I hope you feel better.
Thank you very much.
Alrighty, I'll send your prescription to the pharmacy.
Okay,
Okay.
thank you.